Hey, Dr. Dave here. Help for my lower back pain is one of the top search requests on the internet and the #1 problem leading people to seek my help. So I can safely assume that you have or are currently suffering with lower back pain. That is because over 80% of our population will deal with low back pain during their lifetime. Now, as a corrective care chiropractor, I work on patients all day on my tables, and my posture is not always ideal, and I tend to stoop over. Very similarly to if you work at a desk or a computer, you drive frequently, or you have a manual job where you're lifting and twisting. That posture, these situations leads to lower back pain. Now, lower back pain can come from both muscle strain and inflammation of the nerves from spinal misalignments, also known as nerve pressure. So when assessing the lower back, ideally you want to see that the spine is straight from front to back. And then from the side, there is a C-shaped curve in that at the base. This curve allows proper weight distribution from your torso when you're sitting or lifting. Now, if one of these bones shift out of alignment, or you've lost that curve in your low back, your body weight will push down and compress the pads between the bones. These are called vertebral discs. Now, this compression can lead to inflammation. It can lead to pain in the lower back, pain down the leg, cause sciatica pain, and affect digestive and reproductive health. So stretching the lower back is very important for me to function well, reduce injury while I work, and the same goes for you. So I want to show you several exercises that I do on a daily basis for this exact purpose. I also take the time to teach my patients these stretches one-on-one in the clinic. Now, the first exercise is called spinal hydration. It's an easy and effective way to bring nutrition and hydration to the discs, which restores mobility to the spine, reduces inflammation, and can alleviate pain. Now, using an exercise ball, a balance disc, or we call this a wobble cushion in my clinic, and I'll show you why. When you sit down, you wobble around, so be careful as you get seated. Now, when you sit on the disc, it's important you sit with good posture. Sit upright with your shoulders back. There are 3 moves for spinal hydration. First is our side to side. Put your hands on your hips. Tip one side, bringing your ear to your shoulder. Then tip to the other side, bringing your ear to your other shoulder. Each side counts as 1 repetition. So the count would go 1, 2, 3, 4. Next is the front to back. You're going to round your shoulders forward and squeeze, then bring your shoulders back and squeeze like this. 1, 2, 3, 4. Third is the twist. Cross your arms at shoulder height, keeping your head in line with your arms, and you twist from side to side like this. 1, 2, 3, and 4. So for each of those moves, repeat for 20 repetitions. Perform these at the level that feels comfortable to you. These should not cause pain, and if they do, take it slowly. Don't push so far and modify as needed. Start at your level and then build up. Next, you want to target the muscles in the low back. Now, this simple stretch works deep into the muscles that attach from the spine to the hips. You'll need a low back wedge like this, or you can use a tightly rolled bath towel. You'll lie on your back using the wedge or towel as support for the lower curve, placing it just above your hips. Like that. Bring one knee up to your chest and hold for 30 seconds. And then do so with the opposite knee. Then do both knees at the same time, trying to hold this stretch for another 30 seconds. Now, if any of these exercises causes you pain, or you have to take an anti-inflammatory or pain reliever on a routine basis, then you need to dig deeper into what the cause is of your back pain. Now, these stretching recommendations are great for short-term relief of low back pain, but if you only mask the pain, you'll never heal the root cause, and you'll always find yourself returning to a state of pain after some time. But if you're like me, your goal is to have no pain, be able to live your life doing the things that you want to do without pain stopping you. So know that there is hope for correcting and putting an end to back pain. Now, the biggest mistake I see people make is where they turn when they're in pain. Medications and surgery should be a last resort. I encourage you to seek out the proper testing to find that underlying cause. For me, as a corrective chiropractor, I help people correct and heal their lower back pain on a daily basis. I use a combination of orthopedic, range of motion testing, along with specific digital x-ray to see precisely where the pain is coming from. And this will tell you if maybe you've lost that protective curve in your low back, your discs are being compressed, or if your hips are no longer level and instead sitting at an angle, putting pressure on those nerves. So a thorough evaluation, proper testing is the best way to find the cause of your low back pain. Then we can work to eliminate and correct the cause and allow your body to heal itself pain-free.